My name is Marie Onyamboko. I'm the Clinical Director of KIMORU, the Kinshasa Medical Oxford Research Unit, which is a collaboration between the Kinshasa School of Public Health and MORU. And we work on improving maternal and children's health through infectious disease control, with a focus on the impact of malaria in these two vulnerable groups. And with the KIMORU staff experience in conducting clinical trials in tropical medicine, we are also engaged on research on antimicrobial resistance. A recent research project we have studied is MIRANDA. In this study, we have shown that using pregnant women instead of children as a sentinel population for the genomic surveillance of malaria was an efficient way of tracking the mutation linked to drug resistance in Plasmodium. The idea was to take 2 drops of blood on filter papers from all pregnant women presenting to antenatal care for further surveillance. And the strategy may look simple, but when you understand that in the DRC, the antenatal care services are well implemented everywhere, even in the remote area, this is a really highly potential intervention, because this can produce continuous data on surveillance without interruption, and the National Malaria Control Program can use it to early detect resistance, but also to adapt or change strategy when needed before it fails in the general population. The big questions surrounding malaria in the DRC are drug and vector resistance, especially now that we have emergence of a strain of Plasmodium, which is resistant to antimalarial drug. But we have also the need of improving the diagnosis and surveillance of malaria to detect early the resistance or the change of sensitivity in Plasmodium. And there is also the need of understanding for mitigation the co-infection with other diseases, as they really worsen the outcome of malaria. And at the end, the need also of innovative strategies that are adapted to the challenging context of malaria in the DRC. There is a direct benefit for patients for their participation to the clinical trials, maybe by receiving free drugs or free care from highly trained staff. But more in general, I would say that our work has ensured that vulnerable groups of pregnant women and children has received more efficient available drugs for malaria, and also their specific needs, like the need of correct dosage or regimen of antimalarial drugs in pregnancy. These needs are addressed. My line of research aims to prevent a global health catastrophe where the antimalarial treatment may become ineffective, because this would reverse decades of progress made in malaria control and will increase the mortality. And the malaria is still there. We have not yet overcome it. So I'm committed to continue to work in that field and contribute to the global transition to the triple combination therapy, and also to find effective treatment for at-risk population, but also in addressing public health strategies to combat resistance, safeguarding progress in malaria control and elimination efforts.